Welcome to the 3D Click Guide Quick Start video. The 3D Click Guide is an award-winning adjustable surgical guide for 1 to 2 implant cases. The guide can be made easily in the dental office or with the assistance of your dental lab. An implant is an object in space with 3-dimensional coordinates X, Y, and Z. The 3D Click Guide does allow the clinician to determine and set each of these planes individually outside of the mouth. The first step is to take an impression. We like final polysiloxane because we can push the tissue down with the putty. It will allow us to really impress a large part of the bony volume, much more than we're commonly used to in dentistry. Measure the soft tissue thickness at 5 points. In 95% of the cases, that's enough information and all you need. Super simple and very precise. If more information is needed, just have the patient wear the VPS impression while taking the cone beam. The soft tissue will show up nicely in relationship to the bone. Pour the impression in an AccuTrack tray or make a Pindex model. Cut the cast and use a denture tooth as a quick and easy wax up. The blue BLP, the buccal lingual positioner, is the first part of the kit that you will use. It allows you to precisely set the buccal lingual position of the implant, as well as where you want the shoulder of the implant to be. This is most often 3 mm below the gingival margin. You can really fine-tune where you want the screw access hole to be. In this case, just lingual from the incisal edge. More lingual will give you a larger cingulum, while more buccal will force you to use a cement-retained restoration. When you reassemble the cast, you will now have locked in place the buccal lingual position and the shoulder of the implant. You can now precisely place the wings between the teeth, because you can see them, while the root section is your best estimation. That is the only thing that can be incorrect, and thus you can adjust the chair side with one of the 3 rotation blocks. The wings are attached to a carrier. That can be a vacuform shim, a thermoplastic, or even just bite registration material. Your choice. Now the crossbar is removed, allowing a rotation block to be clicked in. There are 3 choices. Green is the 0-degree rotation block if no adjustments are needed. This will be the case most of the time. The yellow allows a 3-degree rotation, and the red rotates 7 degrees. Here in this example, the buccal and lingual radiographic implant replicas overlap. So we know for sure that the X-ray is shot straight on, creating a reliable image. The setup is correct, so a green rotation block will be used. Drill guides will allow precisely guided surgery and guided implant placement. In this case, the setup was not correct, and a 7-degree red rotation block instantly allowed the needed correction for perfect implant placement. Thank you very much. For more information, please visit us at 3dclickguide.com.